Are you currently suffering from knee pain that's worse first thing in the morning? Hey everyone, this is Dr. Zach Greenwood here, Performance Sport and Spine, and today's video will be discussing all things knee arthritis or knee OA. The knee is the largest hinge joint in the body and it's comprised of 4 bones. The thigh or femur bone of the upper leg, the kneecap or patella, the tibia, which is a larger bone of the lower leg, and the fibula, which is a smaller bone of the lower leg. Knee arthritis is the #1 cause of knee pain in the elderly, affecting 365 million people worldwide. And it's the second cause of disability behind back pain. Please like our video, subscribe to our channel, and then don't forget to turn on notifications. This condition commonly presents as pain or stiffness in the knee, with these symptoms being worse first thing in the morning after prolonged sitting. Usually within 30 minutes of moving around or exercising, the pain will get a little bit better, and rest greatly improves this condition. More specifically, there's 5 cardinal signs to be aware of with knee OA that we'll cover now. So number 1, is there a loss of range of motion of the knee joint? Number 2, most stiffness should be in the morning, and it usually gets better within 30 minutes. Number 3, persistent knee pain, and this can be anywhere from mild to severe. Number 4, weakness and disability. Daily tasks such as standing or kneeling down should be harder or more painful. And then lastly, some cases can have swelling around the knee joint on the sides. In addition, hip and knee OA are rarely seen in people under the age of 30. You kind of need to live life to have the joints change. So if you're given the diagnosis in your teens or 20s, just be very skeptical. For what causes this condition, a long time we kind of thought this is a simple wear and tear, where the more you used it or the more pain you felt, the worse it got or the more damage you cause. But it turns out this is a very complex biological process that's happening, and there's many factors to be aware of, involving tissue metabolism, anatomical and physiological changes, inflammation, and loss of function. And this affects more than just the joint itself. It does affect the joint, but it can also affect the muscles, the tendons, the ligaments, the capsule, and the synovium. Again, it's more of a systematic process than just things are wearing out. For diagnosing this condition, 2 criteria that are very helpful. So one is pain with palpation over the knee with bony nodules, some kind of growth. And then second are x-rays, and specifically looking for a loss of joint space, sclerosis, so changes to the bone, and then osteophytes, which are kind of like bone spurs. The best stretch for knee arthritis pain is to get a small pillow or a sweatshirt in a seated position. Take that and jam it behind your leg, grab lower on your leg and pull down back towards your buttock, and you're going to feel your knee kind of distract and the pain just kind of melts away. So you're going to want to hold this for 20 to 30 seconds and then repeat, and do this several times a day as your symptoms tolerate. With knee OA, like all arthritises, with the evidence-based guidelines we have, the first line of treatments for all patients, whether you're going for surgery or just have a mild case, is exercise, weight loss, and education. So these exercises that we're about to show you are going to be helpful for anyone. We divided them into 2 levels. Level 1, which are easier in a seated position, and then more advanced ones at level 2. We recommend you start with the level 1 and then progress as tolerated. So for level 1, all the exercises are going to be in a seated position because it can be painful or difficulty for people to get on the floor, and all you're going to need is your hands. So the first exercise is for the hip abductors to help stabilize the knee. So with your knees at 90, you're going to take your hands and place on the outside of your knees. And then you're going to press your knees isometrically out into your hands for 10 seconds, increasing both intensity and duration over time. Now the second one is the hip adductor. So taking your hands, cross them over, and then this time you're going to press your knees inwards to your hands, again holding without moving for 10 seconds, increasing both intensity and duration as your symptoms tolerate. The next one is for the thigh or that quad muscle in the front of your leg. So in that seated position, place your hand on your leg. You want to feel that muscle tense, and we're going to try to straighten our knee. Now some of you might not have full range of motion, that's okay, just go as far as you can. But again, make sure to feel that muscle tense under your hands. If for some reason this is too painful or too difficult, what you can do is kind of lean forward so you have pressure into the floor, and then push that foot out and away from you, and you feel some tension here. One way to progress it is to take the other leg, cross it over, and then press outwards and pull back with the other leg simultaneously. And then lastly, we want to build the lower leg muscles or the calf muscles. So in that seated position again, we're going to raise our heels off the ground, feeling tension in those calves, pause, and then return to the starting position. Again, try to lift your heels up as high as you can, keeping your toes on the floor. To increase the difficulty, again, lean forward, place some of your upper body weight into your hands, and then press up and hold. Level 2, banded hip extension. Place a band around your ankle and then anchor the other side of the band to a weight or heavy object. We're going to press our foot away from that, create tension in the hamstring, and then return to the starting position. Make sure to keep your knees straight for full movement and increase reps as tolerated. Banded hip extension. So now placing the band around the outside of your ankle, anchor the other side of the band. With your knees straight and your hands on the wall, we're going to press our leg outwards, feeling tension over that lateral hip, and then return to the starting position. Again, press out as far as tolerated and increase reps as your symptoms allow. The banded knee extension, we're going to use a band that's anchored, but a cool little trick is put the band around your ankle and then you're going to pull it out and twist it over and then put it under your foot, and that way it's not going to slide. Now that you have the band anchored like we showed you, place your hand on your thigh or quad muscle, straighten your knee as far as you can handle, and then return to the starting position. Again, as you do it, make sure the quad or the thigh muscle contracts under your hand. And again, if you can't go the full way at first or your bones don't allow you, that's fine, but just go as far as you can and then increase the sets and reps as tolerated. After you've done that for a while and you feel stronger, more confident, we're going to do some box squats because it's a functional exercise. You stand and sit many times a day. And if you don't feel comfortable or it hurts a lot, life's not going to be very fun. So with a bench, after you feel strong, with your feet shoulder width apart, we're going to press our hands out, squat down, and then stand up using our thigh and hips. Again, squat down and stand up. Now a couple things you can do is reduce how far you go down at first. You could put something under your ankles to give you more dorsiflexion, or you can put your hands against the wall to help stabilize you. And now lastly, we're going to do another exercise for the calf, but more advanced. So in a standing position with your hands on the wall with your knees straight, we're going to lift our heels up, pause, and then return to the starting position. Again, raise up as high as you can, pause, and return to the starting position. Another exercise that can be a game changer for this condition is cycling. Because again, you get all the benefits of cardiovascular health and endurance without the ballistic load of running. So if you have this condition and you haven't tried cycling, do. Again, you might be better off with a recumbent bike, or if you do feel comfortable, get on your bike, go down the road. Again, start slow, but this can be really helpful. Risk factors for this condition are genetics, being female, high or repetitive loading occupations, elevated BMI, and smoking. Now when you talk about this term, I'm sure you've heard bone on bone. And I think healthcare practitioners that say this term without clarifying it should have to pay a tax because it's really misleading and it can really make people in a rough spot. So again, this condition is a continuum, anywhere from mild, moderate, to severe. So if you're a patient that has mild knee OA and you're told that you're bone on bone, so when you go for a run for 5 miles when you haven't ran in 6 months and you feel pain, you're probably going to think, oh my gosh, I'm wearing out my knee. And really, your body's just saying, hey, you're middle-aged, you haven't ran for 6 months, you got to go a little slower, okay? So when you hear this term, make sure the person specifically clarifies what exactly they mean and the severity of the condition. For some people, a total knee replacement or surgery is going to be the option. And this person's probably over the age of 65 with severe or marked knee OA, and they've really exhausted every other option, including injections and PT. Now this should have been quality evidence-based PT of gradual exercise and strength training, not ultrasound and massage. But most people, 80% after total knee replacement, will have significantly less pain. Factors for a worse prognosis after surgery are smoking, widespread pain in other parts of your body, obesity, depression or anxiety, or long-term opiate use. Thank you so much for watching our video on knee OA. We really hope you found it beneficial and kind of updated your beliefs about it, what it is and what it isn't, and then lastly, some options and treatments to help you get less pain and better function. If you did find this video helpful, please like it and subscribe to our channel, and then don't forget to check out our other videos.